backed and powered by 150 years of business experience. Venue is a virtual data room trusted by the best of the Fortune 500 to move deals seamlessly from one to the other to the next too.
In light of the Affordable Care Act, healthcare has been a hotspot for M&A activity across the board. Whether it's large pharmaceutical consolidation or the massive number of sponsor-backed healthcare IT and services companies that have been changing hands, the pace of healthcare deals shows no sign of slowing down. What impact has all this deal activity had on valuations and the overall deal process? Welcome to today's installment of Merger Talk. I'm Mark Aiello, Vice President General Manager for Venue, the virtual data room platform of Donnelley. Today I'm joined by John Pollock, a Managing Director at Fifth Third Bank. John, thank you so much for joining.
Thanks for having me.
So where are you seeing the biggest areas of opportunity in healthcare today?
So healthcare is a tremendous consolidating industry today, driven by a couple of things. One is changing business model. We're going from the traditional fee-for-service business model that's been in place for decades to more quality-based care. You're now going to get paid on how well are you taking care of the patient as a whole. And two, with the recent Supreme Court decision in King versus Burwell, the ACA has really been, now it's here, it's permanent. And that's created a level of stability, I think, that's created good underpinnings for a quality deal environment.
And where are you seeing sector multiples, and where do you think they're headed in the short term?
For the last 3 years or so, we've certainly been in double digits in terms of multiples of EBITDA, and certainly mid to high double digits for large strategic transactions. It's hard to see them going much higher, but I've been wrong on that before. So certainly we see them being this high for a while.
And how are valuations affecting the level of activity that we're seeing?
Valuations really aren't affecting it that much. We're seeing all sorts of different participants when we're working with companies, if we're selling them, for example. So you're seeing strategic buyers, you're seeing financial buyers, you're seeing financial buyers that already have a platform company looking to add on to it. And so everyone, I think, is saying, okay, the valuations are high, but this is such a great area for growth going forward. I have to be invested in this sector. I'm going to play no matter what the valuations are.
And has anything changed about the deal dynamics or the deal structure, the financing structures?
The only thing that's changed or improved and is improving is the environment for leverage, for debt. Capital is obviously very cheap. It's abundantly available. Terms are very good. And there's a lot of equity capital, and there's a lot of capital on strategic buyers' balance sheets. So conditions are basically perfect for very high valuations for a sustained period of time.
And are you seeing differences in how strategic acquirers and financial acquirers approach the targets?
No, we're really seeing, again, high quality buyers amongst both groups of potential buyers. Certainly strategic buyers are very active. They're now having to compete with financial buyers. Financial buyers are stepping up to the plate to compete with strategics. Often a financial buyer can move faster. That can create a positive deal dynamic. And strategic partners can sometimes move a little more slowly.
And where are you seeing the most successful integration strategies play out?
Well, we're certainly seeing a lot of integration between hospital systems and physician groups. Hospitals are seeking to control the physician controls the patient. When you control the patient, in theory, you could generate higher profitability by providing a very high level of care. So we're certainly seeing hospital and physicians group try to integrate successfully to drive that business model.
John, thanks so much for joining.
Thank you.
Thanks for joining us today. For more Merger Talk, visit thedeal.com.